So we are going to go over A through Z of how to do an IND. We hopefully have all of our supplies set out here. So let's get started. First thing we need to do is actually draw up our anesthesia. So we're going to take our 10 cc syringe, give it a little prime. We're going to open up our 18 gauge needle. Again, this is just easier to draw up medication with an 18 gauge. Make sure it's nice and tight. We have our medication, our lidocaine. Flip the top off. It is a new sterile container, but we're still going to clean it again with our alcohol wipe. I'm going to take the top off. I want 4 cc's of lidocaine, so I'm going to put 4 cc's of air into my syringe. I'm going to flip my medication over, insert, make sure my tip of my needle is in the solution. Insert 4 cc's, pull out little more than 4 cc's. Do have a little bit of an air bubble. I'm just gonna spray that out. This is a safety needle. I'm gonna engage it since I no longer need the 18 gauge, and I am going to use a smaller 25, 23, 27, whatever you guys have at home. And now my anesthesia is ready. I'm gonna now do some local on my abscessed area. Over in this area is where the concern is. I'm going to clean the area completely with an alcohol wipe. I'm then going to do a field block. I'm going to tilt this a little bit so that you guys can see. I'm going to insert parallel along the outer aspect of my abscess, pull back to make sure I don't have any blood, which I don't. And as I pull back, I am injecting the lidocaine. Turning my needle, inserting, pull back, no blood. As I'm pulling back, I'm injecting the lidocaine. So now I have 2 aspects with the anesthesia. Come top, same thing, pull back, no blood, insert my anesthesia, re-angle my needle, insert, pull back, no blood, put my lidocaine in. So now I've done a field block completely around the area of the abscess. I'm going to save this just in case we need it later. Next step is prepping the area for the IND. I'm going to take my betadine. Start from the center, work my way out, bigger than I anticipate needing, 3 times. In the real world, we would let this dry for a while, but we're going to keep moving on. Take an alcohol wipe and do a final cleansing of the area, again in the circular motion, starting on the inside, working my way out. I am now going to drape my patient. Touching the drape as minimally as possible. Now I'm going to put whatever instruments I need onto my sterile field. So I would be opening these sterilely. I'm just gonna kind of drop them onto the field. And all these would be open individually. I have my syringe just in case my patient reacts. And I could have this Q-tip. Okay, so now I believe I have everything. If not, I would ask my medical assistant, nursing assistant, or somebody to help me. Now I'm going to apply my sterile gloves. So before I start anything, I'm going to take my forceps and give my patient a little pinch. and ask them, can you feel this? If they can feel it, I'm gonna give it a few more minutes for the medication to step up, to start. If a few minutes goes by and they can still feel it, I need to re-anesthetize. If I give them a pinch, they can't feel it, I'm just gonna let them know they may feel pressure, but they should not feel pain. If they feel pain, they will let me know. Okay, I'm gonna open this up too so that this is ready. Okay, so I'm gonna take my 11 blade. I'm going to grasp, I'm gonna kind of tilt it so you guys can see. I like to hold it as a pencil, so we don't want a sawing motion. We want a nice, smooth incision. What I can do is take my hemostat, stick it in here and kind of open the area a little bit, and I can see the abscess. Next thing I'm gonna do is give it some pressure and get out as much as possible. I can wipe this away. Open this up just a bit more. Get my sample nice and deep. Try not to hit the skin. Insert it in my packaging. Send that to the lab. Okay. At this point, I want to clean it out as much as possible. I'm also going to take a syringe full of saline or saline mixed with a cleaning solution and irrigate the area as much as possible, and take a Q-tip one last time to do one more circular motion to make sure I don't feel any tracking. At this point, we've irrigated, we've cleaned out all of the exudate and pus that we're concerned about, and we've taken our sample. So now I'm going to pack the wound with the iodine. And I'm just gonna shove this in a little bit at a time until I can no longer pack it any further. Leaving a little bit of a tail. At this point, I can go ahead and put my dressing on. Secure it with tape.